So in PathCare, we offer a variety of tests that can actually help to diagnose fertility, infertility, and menstrual disorders. Some of these tests include hormonal tests, which are estradiol, the follicle stimulating hormone, and luteinizing hormone. This test should actually be done on the third day of your cycle. Reason being that on the third day, it will actually give a clinician results that actually make sense. So if you do your follicle stimulating hormone on the third day of your cycle, this will assist the clinician to know and evaluate your egg supplies and also your ovarian functions. Progesterone levels are usually checked after day 14, that is after you ovulate. This is because after day 14, your progesterone levels tend to go higher, and they can actually help a clinician to know whether ovulation has actually taken place. So the level of your progesterone levels can actually tell whether a pregnancy has actually taken place or not. We also have prolactin levels. These are usually done to check if the levels are too high. If they're too high, they could actually indicate that you have a benign tumor. So the higher your prolactin level, the higher your chances of having this tumor, which could actually be the cause of irregular periods. We also do a test called the beta HCG. Beta HCG is the human chorionic gonadotrophic hormone. It's a pregnancy test that is usually done in blood. It is one of the most sensitive pregnancy tests done because it can actually detect a pregnancy 1 week after conception. Meaning, if you do a beta HCG 1 week after you've missed your periods and you're actually pregnant, it will actually pick the hormone and actually give the age of your pregnancy. We also encourage blood work before an IVF is done, that is an in vitro fertilization. And this one is usually important to actually help the fertility specialists to understand the quality and quantity of eggs in a woman's body. These fertility drugs usually contain these hormones. The hormones are supposed to stimulate your eggs to mature and encourage ovulation to occur. Now, doing a blood work before you actually go for an IVF will actually help the fertility specialist to know how much of a drug to administer to you to actually help you to get pregnant. And the other test is anti-Mullerian hormone. This one is usually done to check the woman's ability to produce eggs that can actually be fertilized for pregnancy. As a woman grows older, the number of eggs tend to go lower. So when you do this AMH test, it actually tells how many eggs are still fertile in a woman's body. So it helps to show the potential of eggs that a woman still has left in her body.